All right, we're going to give it just a couple more seconds here to let folks trickle in. For those that are here, welcome. We'll get started here in just about 30 seconds. All right. Well, as folks continue to join, we'll go ahead and get started so that we have enough time to get to our Q&A session at the end, because I know that's always important and always interesting to hear from you all, and is definitely why we're here to help. So what are we here doing today? Well, this is part of our FNS Food Safety Continuing Education webinar. For those that have seen some of these in the past, welcome back. I'm Josh Scheinberg. I'm a food safety specialist here with USDA Food Nutrition Service. And today we're talking about a grade A story, 100 years of milk safety. So as you'll hear today, we picked this topic to talk about from a food safety standpoint because it's the 100th year anniversary, or at least it was in 2024, the 100th year anniversary of the Pasteurized Milk Ordinance, this thing called the PMO that we probably take for granted, we don't think about. Many of you maybe never heard of it, but we're going to talk about that today. So let's jump in and I'll introduce our panelists and speakers today, and you'll hear more about what we're going to talk about. So let's meet our speakers. So as you've probably heard in some previous webinars, we've invited some actual researchers in the fields that we're talking about. So today we've done that again, and we're really excited to have Dr. Joanne Van Kessel join us. She's a research animal scientist from USDA Agriculture Research Service in the Environmental Microbial and Food Safety Laboratory, and her focus is in the dairy system. And she's going to talk a lot about food safety related to the dairy system and where we are today with different concerns we have for milk and other areas of the dairy world. And she's going to kind of give us really an inside look at what kind of research we're actually doing in the field of milk safety. So excited to hear from her today. We're also really glad to have Sharon Schaefer from the Institute of Child Nutrition, someone I'm sure many of you have heard before and are familiar with or have worked closely with, is joining us here for our Q&A session to help answer questions related to milk and dairy. As many of you know, she's not just the Associate Director of Strategic Initiatives and Outreach at ICN, but she's a child nutrition director. She was a child nutrition director, a school executive chef. She's been an operator, an educator, an advocate. She's a graduate of Culinary Institute of America. So just bringing a whole important experience here today to help answer questions related to milk and dairy. We are also joined by one of your own, Judy Polem, who is a food service director at Wayne Community Schools. And Judy was born and raised on a grade A dairy farm in Wayne County in Wayne, Nebraska, where her family continues to operate that dairy today. So she has not just a whole load of experience from a professional standpoint in school lunch in the dairy world, but she's lived it, she's breathed it, and she's going to help us answer some questions here in the Q&A session too. So really glad for Judy to join us here. She has over 42 years of experience in the school nutrition area, and she's here to help us really bring her reflections and experience in the topics today. So really thankful for her to join us as well. And of course, we have my colleague, Michaela Dew-Johnson, food safety specialist, and myself, Josh Scheinberg here, will be also joining in that Q&A session. And I'll be giving a little bit of a presentation here for the next 10 or 15 minutes, talking about the history of dairy safety. So we'll hopefully be able to answer any food safety related questions you had. Okay, so let's jump in. What are we going to talk about today? It's really trying to summarize 100 years of milk safety in about 45 minutes, right? That's what we're going to try to do today. You know, and I think it's important to really look backwards, right? It's kind of amazing when you do read the history and you really start diving into the history of our milk consumption in the United States and its introduction into schools, you realize that it's really not that long of a history. And it wasn't that long ago where milk wasn't considered such a safe food ingrained in our diet. And we'll talk about that. Dr. Joanne Van Kessel is going to get into some of the science of milk safety, and we'll also share some resources and tips that you can use here before we get into the Q&A session. All right, so we talked about that it's the 100th year anniversary of the PMO. What is the PMO, right? Besides a interesting acronym, well, it's the Pasteurized Milk Ordinance. And actually, when it began back in 1924, it was called the Standardized Milk Ordinance, right? So it's had a name change over the years. And really what this is it's as simple as a set of standards for how to make milk and the quality and the food safety standards that accompany that, right? And as simple as it sounds, and as long as it's been around, it's so critical. It's so important and continues to evolve and change. And you can go ahead and read it. You can go on the FDA's website, just Google Pasteurized Milk Ordinance. You can read the latest one. If you have a couple hours to kill, it's a great read, great read there. But it gives you an idea of really how detailed we get into the standardization of milk quality and milk safety and other dairy items as well. And it's important that we reflect on this because before these kinds of standards, milk was not a safe product. And one out of every 4 foodborne illnesses was related to dairy consumption. And it's actually worse than that, really, because back in the 1800s, probably mid to late 1800s, the number of infants that dying from milk-related diarrheal illnesses was extremely high, in the thousands, and it really was serious. Back during this time, there was this term called swill milk. So you probably heard this terminology swill before. I know I had and didn't know where it came from, but it comes from this era. And during this time, it wasn't just that milk wasn't a safe food, but water wasn't either. Okay, sewers weren't invented yet. There wasn't really water treatment that we think about today. You had a period of time where cities were growing; they were becoming overcrowded, and there wasn't that connection from a food distribution standpoint from the rural communities, the farms, to the cities, because we didn't have refrigeration, right? And rail was the only way to get food and other supplies in and out of the cities mainly. And so milk, right, was actually becoming popular at the time because water wasn't as safe. Alcohol, was also a trusted beverage to consume at the time. And the distillers figured out that what they could do is make more product based on the waste of their distilling. And so they set up these really makeshift dairies in the back of their facilities where they were feeding cows the spent grains and all sorts of just leftover materials from the distilling process. And these aren't the kinds of distiller grains we think of today. And this was really nasty stuff. It was really bad for the cows. They were diseased. They were in very difficult, filthy conditions where couldn't move. And really the whole purpose was turn that waste into milk, sell the milk to the consumer. And that's what was happening. These were called swill dairies. And this picture here just shows you this cow that had to be hoisted up because it couldn't, continue standing, but the milk continued flowing. And it was so bad that because of what they were feeding the cattle at the time, it was known that the milk could have a bluish hue. And so they would add things like flour or even plaster of Paris, it was reported, to make the milk whiter. So not a great time for milk consumption, obviously. And because of all the illness, there was eventually a public outcry for it, and swill milk was banned. But even during that time, there wasn't really an alternative in the major cities until we had some innovation. Some bacteria was discovered to be able to be counted in milk in the 1880s. Pasteurization, of course, happened in 1862 by Louis Pasteur. And by the way, what I don't have here is refrigeration was important as well, because once we could pasteurize milk, ship it into the cities via rail from the farms, now you had a comparable product that wasn't this swill milk, but you actually had farm fresh milk. So there was a lot going on at that time, but it's important to know that this was an evolution, right? Milk was not a common it was not a common beverage that U.S. Consumers had at the time. It was really for children. It was really marketed toward them, and of course, that had deadly consequences. So, post pasteurization in 1862, we had states start to adopt it as the law. So New York was the first, I believe, to require pasteurization in milk. And then we finally had a national standard. The US Public Health Service at the time, this was pre-FDA, pre-USDA, we didn't have these health organizations. We had what was called the US Public Health Service, sort of a different entity that it is today, created the Standard Milk Ordinance, right? That first set of standards to say, this is how milk should be, should be produced and bottled, the standards for bacterial counts, pasteurization, of course, all that was in there. And it really changed how we use and consume milk today. So I'm sure many of you know what pasteurization is, but there might be some of you that aren't familiar. You've heard the term, or maybe you didn't really know exactly, what it was all about. So it's a pretty simple process. It's one of the simplest antimicrobial treatments that we have for liquid products, including milk, and it is just a mild heat process. And that mild heat that we treat the milk with, it destroys those pathogens, those bad bacteria that can cause illness in the milk, and it also has the added benefit of destroying some of those spoilage organisms that spoil the milk as well. So we get both the safety and we get the shelf life from the pasteurization. Now, it's important to know, as I mentioned, the focus at the time for pasteurization was nothing to do with milk. Louis Pasteur really focused on ensuring wine and beer didn't spoil, right? So it kind of gives you where people's heads were at the time. So today, this is what a modern pasteurizer would look like. In a small operation, you would likely see something called a batch pasteurizer, which is exactly what it sounds like. You're filling a tank here on the left with that fluid milk. You're heating it to 145 degrees for about 30 minutes. It sits in that tank, and then it goes through a series of pipes and is distributed and cooled during that process. And it's fairly simple. But even during the early days of pasteurization, there was a lot of playing around with different times and temperatures. And as the technology improved, we were able to do a process called HTST, which you probably heard of, which means high temperature, short time. So that's where we're bringing milk up rapidly to 161 degrees Fahrenheit for 15 seconds. So much faster. You can much faster process, more efficient. You can move more volume through. So a lot of the milk today is processed through this HTST process. But either way, it's both are a pasteurization process. You're getting that same effect. Now, back in the 50s, there was continued experimentation, and as the refrigeration, cooling, and heating equipment became more advanced, they were able to do something called UHT, called ultra high temperature. And this is where we bring milk up to about 280 degrees Fahrenheit for 2 seconds. It's a very rapid heating and then a very rapid cooling. And once that is complete, that fluid milk or whichever liquid is being UHT'd then gets aseptically packaged into a sterile container. And by doing that, we can have a shelf-stable product, something that doesn't need to be refrigerated. And I'm sure many of you are familiar with what I'm talking about. That's the milk you see that isn't in the refrigerator, right? That can be out on the shelf and has that long shelf life. So just wanted to give you that background in case you were wondering why there was a difference between milk that was in the refrigerator had to be refrigerated and those packages that we see out there that don't. So real quick here, just a quick history on what about schools or milk in schools? When did that start? Well, again, this is really more of a modern phenomenon in the United States. It really wasn't until the 40s that we actually started to see a real effort in schools to introduce fluid milk. In Chicago, I think the Chicago School District looks in 1940 introduced 1 cent milk into their 15 schools, and it really just took off from there. By the late 40s, the school milk program was nationalized. It was incorporated into this new thing called the National School Lunch Program at the time, and continued, right? By 1954, the special milk program expanded that, and we saw over 400 million half pints sold. And that sounds like a lot. And let's look at the next bullet here. In 1966, with the Child Nutrition Act, 3 billion half pints sold in a year. Also sounds like a lot. But if we do some quick math, if we think, well, a school year is what, 180 days in some school districts? I don't know what it was back in the 60s, but if we do some quick math, we're looking at roughly about 17,000 half pints a day. I bet you probably don't know what it is today, but I looked it up for this presentation for you. It's over 240 something million half pints sold every day in schools. So that just gives you an idea of where we are today with milk, how far it's come. And I think it's really great to think, wow, in 100 years, we went from swill milk to over 250 million half pints sold in schools. So very interesting history. And with that, I'm going to hand it off to Dr. Joanne Van Kessel to now shift into talking about what are the current food safety issues we think about with milk today. What do we need to keep researching, and what ARS is focusing on today? So I'll hand it off here.
Thank you. I was trying to figure out how to unmute. Sorry for the delay. Thank you, Josh, for that introduction. And thank you for providing that background on, when pasteurization was invented or developed, and the Pasteurized Milk Ordinance, because I think that's incredible history from a food safety perspective. And I think it's, the implementation of that Pasteurized Milk Ordinance has done so much to protect especially the children. And when you think about how much milk, as you mentioned, is being sold in the school milk program, I really appreciate that background that you gave. Hello, everyone. I am excited to be here with you this afternoon and sharing some of the work we do in this program. Before I start, I was asked to tell you that if you have questions, there's a Q&A section that you can type your questions in, and we'll have a time to address them at the end of our presentations. So as Josh mentioned, I'm a scientist with the USDA Agriculture Research Service. I work at the Henry A. Wallace Beltsville Agriculture Research Center in Beltsville, Maryland, and we're a large center, about 7,000 acres, multidisciplinary ag research, and we're located just outside the Beltway around DC. So a nice bucolic setting for us to work in the busy urban area of the DC, Maryland Beltway. I've been here since with the USDA since 1996. I grew up on a dairy farm in Eastern Canada, and that's what spurred my interest in agriculture. And it took me a while to work my way towards doing the agricultural education, but I did that, getting my PhD in 1996, and came to USDA ARS from there. Let's see. So before I start on giving you an overview of the research I do, I thought I'd tell you a little bit about who we are at the Agriculture Research Center, or the Research Service. We are one of the agencies within the U.S. Department of Agriculture. We're the principal scientific research agency, so we're non-regulatory, and we're focused on doing research that offers solutions to problems in agriculture. And our projects are split into 5 different groups: animal production and protection, crop production and protection, natural resources and sustainable ag systems, nutrition, food safety, and quality. Now, nutrition is human nutrition. We have a large human nutrition component within Agricultural Research Service. And we have the Office of International Research Engagement and Operations. So a diverse group of projects and focuses. To make that happen, I think we have locations in all of the states. I'm not 100% sure on that, but we have around 95 research locations, most of them located across the country. A few are located overseas. We have around 8,000 employees, and an annual budget, I believe in last year, was $1.7 billion. The program under which I work is the Food Safety National Research Program, and we're envisioning this program. Again, it's a national program with scientists who are working all across the country, with the vision of enhancing and protecting public health and agriculture through development of technologies, strategies, and data that safeguard food from pathogens, toxins, and chemical contaminants. And this is all aspects of the production of the food supply are included here. So you can see we focus both on animals and plants. So I guess if we just want to ask the ultimate question of why do we focus on food safety and why are we concerned about food safety? The U.S. does have a very safe food supply, and I think, we are all aware of that, especially if we start to travel to other countries. According to the CDC, however, there's 48 million cases of foodborne illness each year. That's about 1 in 6 of the U.S. population. And 128,000 of those result in hospitalizations and 3,000 deaths. These are average numbers and based on I guess I would say educated science-based guesses by the CDC. When it comes to outbreaks associated with milk, Josh was talking about in the early years that 1 in 4 illnesses were often due to milk. Well, I didn't do the numbers here, but for the most part, based on this one study from 2009 to 2014, they saw an average 760 illnesses per year associated with dairy consumption and 22 hospitalizations, but 96% of those during that time was due to consumption of raw or unpasteurized milk. So the pasteurization process, is critical to know here. So, if we're talking about, when I talk about dairy, I like to give people a little overview about the dairy industry in the U.S. because not everybody's familiar with it. We, in the U.S., I believe these numbers are from 2023, and there were 26,290 dairy farms. These numbers have been decreasing significantly over the years. In fact, I went back to get some slides when I was putting this slide set together. I went back to get some slides out of presentations I'd done over the years. And one of them from sometime in the early 2000s said there are 60,000 dairy farms. So continual decrease in the numbers of dairy farms. Generally, that's not seen as much. The decrease isn't as obvious with the number of cows. The farm size is tending to get larger. We have about 9 million cows in the country. And on average, then, those cows produce 24,000 pounds of milk per year. And just so that's kind of hard for us to visualize, but that if you think about one cow, than producing an average of 24,000 per year. That's about 10 gallons per day. We talk about a 305-day production. So that's a lot of milk. And also the dairy industry contributes significantly to the beef produced each year to the retail beef market. Something else that's interesting and important to understand when we're looking from the research side is that each farm is unique. This is different with the dairy industry compared with, for example, poultry or swine production that have much more homogeneous production styles. But in the dairy industry, there's lots of diversity in terms of size and how the animals are housed and what the animals are fed. And sometimes that simply relates to the location where they are geographically. For example, cows that are in sort of the southern dry climates are managed much differently than those that are in, say, the northeast of the US. And this is important for us to understand and remember when we're doing research that, you know, we can't provide one size fits all solutions, so anyway, that's what we see in the dairy industry. So our talk about is food safety. It means that we need to talk about zoonotic pathogens. So a zoonotic pathogen zoonotic means something that can be transferred from animals to humans. And animals are reservoirs for a lot of different zoonotic pathogens. When I'm sure you've heard about foodborne outbreaks associated with Salmonella or Listeria or Campylobacter, and these are not uncommon species to be found in, for example, a dairy production environment. Also, I know you've heard about E. coli, which is short for Escherichia coli. And, you know, we all have E. coli in our GI tracts, and a small percent of the E. coli population, though, is what we call shigotoxigenic E. coli, but they are pathogenic and generally cause disease in humans, and often those are found in dairy and beef environments, production environments. One of the things to note about this is the animals are often asymptomatic, and they don't have any adverse health effects associated with carriage of, say, the pathogenic E. coli or Listeria or Campylobacter or Salmonella. Salmonella is a big group, and there are some Salmonella serotypes that do cause disease in cattle, but many serotypes do not cause disease in the cattle. So we wanted to, when I first started working in this area, the question for us a bit was, you know, well, what's the percentage of, you know, how much of these pathogens end up in the bulk tank milk? So the bulk tank, and I'll be showing you a little more of this later. This is a picture of a example of a bulk tank. So I just mean by these bulk tank milk surveys is it's a survey of the milk collected at multiple herds across the US. And the tank is a way to grab a sample of milk from, you know, a representative sample of milk from the whole herd. So when the cattle or cows are milked, the milk goes into a tank like this. And we, with our partners at the Animal Plant Health and Inspection Services, another sister agency within the USDA, we sampled tanks from across the country in 3 different years. And I tried to sort of just simplify and say, yes, we found pathogens there. Probably about 20% of the samples were positive for Salmonella, 6% for Listeria monocytogenes, and 24% for Campylobacter. And we actually found very rare instances of Shiga toxigenic E. coli, but I leave it here because this has been known to cause outbreaks, small outbreaks associated with consumption of raw milk. So we do know that it has entered into the milk supply. So our question then was, can we control the contamination of the milk that is in the bulk tank prior to having it shipped to the processor? To give you a little idea of some of you may or may not be familiar with dairy farms. So I wanted to give you a little bit of an idea of how the milk is, how the cows are milked. And this would be, very brief explanation. But, when I was a little girl, I did a little bit of this, hand milking cows. This is a very rare occurrence now in the US for milk processing. I mean, but it does happen. But for milk that's heading to retail sales, it's very unusual or a rare event. For the most part, cattle are milked with some form of milking equipment that looks like this. They have a milking unit. The cows have 4 quarters, so 4 teats, and this unit has 4 cups that is attached to the cow. This is a vacuum system that pulsates and draws milk from the cow. The milk is extracted and ends up in a bulk tank, like I mentioned, quickly cooled, and they're held there for a day or 2 days, usually at the most, where then it's transported through, again, a truck, insulated, that's not the right word, but a truck that'll keep the milk cool, to a processing plant where it gets processed into fluid milk or other dairy products. So my point of showing you this slide here is, if you look where the udder is and where the milk's being extracted, this is at the back, and so this is where the cow poops, right? So there's been a lot of work done into developing best protocols for milking that minimizes the amount of debris and pathogens or poop that will go into the milk system and with the milk into the bulk tank. That includes things like a lot of management to keep the cows clean to start with, and then prior to milking, the udders get generally, well, it depends, either washed or a pre-dip of a sanitizing dip. And then when they're finished milking, they also get some kind of a sanitizing dip. I'm doing this in a few minutes, but many years of research have gone into developing very strong, well planned out hygienic protocols so that the milk that enters the milk tank is as clean as possible. The interest that we had is to still look at additional protocols to try and minimize the amount of pathogens going in the milk. Then we would like to see what we can do and how we can study what happens to, for example, Salmonella in a dairy herd. How is it transmitted between animals, and how does it come into the herd to start with? And we looked at essentially the ecology of Salmonella in multiple dairy herds. And I want to tell you about just one herd that we studied. This was probably one of the most frustrating parts of our research in some ways. And this was a herd that we sampled very regularly for at least 8 years. And I'm sorry to throw these graphs out you. This will be the only one, but what's on this axis is the percent of cows in the herd that were shedding salmonella. So we sampled the feces from individual cows and isolated salmonella. And you can see we, over these 8 years, we never saw a evidence of completely removing the salmonella from the herd. We had, sometimes a very high percentage shedding and sometimes lower, but we were never able to completely remove the salmonella carriage in this farm. And that was with a lot of specialists visiting the farm. The farm had very good hygiene, their cattle, very good management. Extension folks visited them as well. So a lot of work done on this one herd to try to say, okay, we don't want to have salmonella in this herd. How can we get rid of it? And we just weren't able to do it. And that's the frustrating part from our perspective. And we're still moving forward with studying. By the way, the herd was the animals, the salmonella that was in this herd, the animals were healthy, high producers. There were no issues associated with their health, associated with carriage of the salmonella. So we're continuing, we're working more at this point with our colleagues across the country, focusing on salmonella itself and how we can learn more about this bacteria to then go back to places like dairy farms, produce farms, and other areas to mitigate salmonella being an issue in these places. One more comment on this, we did monitor the bulk milk through this time as well, and sometimes we isolated salmonella from there and sometimes we didn't. The milk from this herd went to processing plant, it was pasteurized, it was not sold as raw milk, and so there were no risks to the consumer from drinking milk that had been sourced from this herd. And this is I just want to reiterate this sort of that you can't tell by looking. The herd that I just spoke about was a very well managed, very clean herd. And these are old slides from one of our scientists from a lot of years ago. It was looking at Cryptosporidia in dairy calves. And Cryptosporidia is a parasite. It's also a zoonotic pathogen. And, this little calf on the left in this dusty, dark barn, the calves in that environment, only 18% of them were carrying Cryptosporidia. This, very nice, clean, dry facility. These calves, 72% of them were carrying Cryptosporidia. So sometimes it's really hard to tell, and you just can't tell by looking. You have to go in and sample and test. So to summarize this section, and I'm sorry if there's some background noise here, there's some issues with our HVAC, and I think they're in the attic working on it. To summarize this section, I just want to repeat again that dairy cows and farms are reservoirs for zoonotic pathogens. Presence and persistence of these pathogens can't be predicted by animal health or milk hygiene practices or other farm practices, and that we continue to look for new ways to reduce the size of the reservoir of various pathogens on the farm. And it's a good reminder that we still, and I appreciate Josh's introduction on this. I'm sorry. It's just a good reminder that the importance of milk pasteurization to reduce the disease-causing organisms and of course to extend the shelf life by reducing the spoilage organisms. And I will repeat this. I've repeated this slide because I just want to come back to showing that, you know, we know there are a lot of there are pathogens out there and associated with animal food production. And when it comes to dairy, the pasteurization, you know, there's a lot of work being done to you know, try to mitigate that. But in the meantime, in terms of dairy, you know, the pasteurization works, right? I think if these numbers would be much higher if for certain without pasteurization. I want to change directions just a little bit for a few minutes to talk about antibiotic resistance. I think you probably all heard the news about concerns about disease-causing bacteria in humans and in animals that develop a resistance to the antibiotics of choice that they're being treated with. And this is a global concern. It's something that is high on a priority list for the WHO as well as for the U.S. government organizations. We are looking down the road. It's one of the human health, major human health concerns. And so one of the issues is of concern is antibiotic use in food animal production and in animals in general. And I want to reiterate that antibiotics are important tools for animal health and welfare. If an animal is sick, has an infection with a bacteria, you know, bacterial caused by a bacteria that can be treated. We want to be able to treat those animals with antibiotics, and that's what they're used for. They're used for controlling spread of disease. If maybe you have a flock of chickens, or for example, and there's some or in a dairy herd, you have some that are infected with a bacterial disease, and they often or can have the ability to treat the rest of the herd or flock to prevent the spread of disease to the rest of the animals. At one time, antibiotics were used in some food animal production as a prevention measure for infectious disease, but in recent years, that use of antibiotics has been drastically reduced. Antibiotic use in animals, as in people, is regulated by FDA, and there's a requirement for veterinarian prescriptions for the most part for treating animals with antibiotics. So in that light, since we're talking about milk and dairy, antibiotic residues in milk and in meat are regulated and monitored. What I mean by antibiotic residues is that small amounts of antibiotics that might be retained in the milk or in the muscle after treatment. And so as part of the FDA regulations, when an antibiotic is given in any situation, say to a dairy cow for some infectious disease, whether they have a diarrheal disease or maybe a mastitis infection, the antibiotic used must be one that's okayed by FDA. And then specific usage, FDA dictates the quantity that must be given, as well as the withdrawal time. So what I mean by that is if a lactating cow has been treated with an antibiotic, that milk from that cow has to be diverted for a certain amount of time after the last treatment and diverted from the bulk tank and diverted from any diverted from being sent to processing for human consumption. So to ensure that that happens, every tank of milk is tested before processing. Typically, these trucks, before they unload, when they arrive at the processor, they're tested. And if antibiotic residues are found, the offending producer doesn't get paid for their milk, and they have to pay if their milk has been commingled with other producers in that truck. They also would have to pay for the loss of the milk for the other producers as well. So there was a big study done a long time ago, more than 10 years ago now, but to ensure that this is being followed well, and there's really very, very low levels of milk that are test positive for any one of 31 residues that are being tested. They also test animals at slaughter, culled dairy animals. They do the same for beef. They're inspected and tested at slaughter, and also very low percent are test positive for residue violations. So this is important aspect of food animal production that I wanted to share with you. So there's still impetus for reducing antibiotic use in food production animals, and Agriculture Research Service, as well as other research entities like at universities, are continuing to do research to try to find alternatives to antibiotics. And sometimes the other work that's being done is also to look for example, develop better disease testing methods. So antibiotic use can be more targeted to specific bacteria rather than a general group of bacteria. A lot of research being done on vaccine development. If you can provide a vaccine against a particular pathogen, then much reduces obviously the disease and need for treatment. Sometimes probiotics and additives are useful, changes in nutrition, and the obvious disease prevention and control. So there's continues to be a lot of research done on again, reducing antibiotic use in food production animals. I've talked till now about, work and research and at the sort of production level, and I haven't talked at all about the processing part. At the processing plants where milk is pasteurized and processed into various dairy products, cheese, yogurt, or bottled in as fluid milk. There's a significant effort and hygiene protocols put in place for preventing incursions into the final product of any pathogens. And the industry working really well together through the Innovation Center for U.S. Dairy. There's a lot of these companies come together and share best practices and look for ways to improve their production practices, to build in multiple hurdle technologies so that the potential for incursion is reduced to as close to zero as possible. And I just wanted to share that there's a lot of work done by the processors as well to ensure the safety of the milk and milk products that leave their plants. So I hope that I've impressed upon you that in order to get this very safe, hygienic product to the grocery store and to the school lunch rooms, that this is a result of a lot of work done at every step of the process, from the farm through the processing and deliveries. There's a lot of research that continues to be done by the government, by universities, by the processors, and this is a dynamic situation. Everybody, there's a lot of effort to continually try to improve the process, and also to be prepared for emerging issues that come to light that we weren't planning for. So anyway, that's for the most part what I wanted to share with you. I think I might have missed a couple things that I intended to mention, but I'd be happy if you have any questions. These are just some of the cows at my brother-in-law's farm, but I'd be happy if you have any questions to help answer some of those in the Q&A session.
Thank you so much, Dr. Joan Van Kessel. Really appreciate your insights and sharing some of your research and expertise here. As she said, just going to stick around for Q&A. So there's already some questions in the Q&A box. If you have any more, go ahead and put them in there. And at this point, I invite Sharon to come on briefly to share some ICN resources, and then we'll all head into our Q&A.
Awesome. Thank you so much, Josh and Dr. Van Kessel. ICN so appreciates the partnership and the history lesson, the knowledge that you shared, the information, and we would be remiss if we didn't take an opportunity to share some of the ICN resources that we have for all of you that have joined us on this webinar. And thank you so much for joining us. The first category of resources that I wanted to make sure you knew were available to you as a linked resource within this webinar. And after the webinar closes, this recorded version will be available in our iLearn portal. I've selected some fact sheets and PDF printable, really amazing pieces of material designed by our ETS team. Everything from how school food allergies should be managed within that milk and dairy category, how it is a component in our school meal programs. I noticed in our Q&A, we have some of our CACFP family and friends here as well. So I will be adding that to our iLearn, how it is a milk component during those meals. Micro training is wonderful if you feel very knowledgeable and confident in milk and how it fits in your program, but you're in a position of teaching others. Our micro training classes give you the opportunity to print a document, and it shares with you what to say, what to show, and puts all of the resources in your hands. The next category that we've uploaded for you to refer to is going to be our SOPs, or standard operating procedures. Milk very much is dealt with the same as all other products that need time and temperature as a control factor. So you'll have access to the SOPs for how to receive your milk products, how to hold and keep your products safe, how to transport your dairy and other products to satellite or remote sites. Summer feeding's right around the corner, so that's a great one to have. Date marking, ready to eat, time temperature control for safety foods. You might think, well, it already comes to me with a date because we have that fantastic system on our cartons, pouches, and bladder products that's date marked. However, smoothies, yogurt parfaits, and other uses of dairy products are increasing in popularity across the nation. So as you repackage your milk-based items, you want to make sure that you have your date marking SOP on hand. And last but not least, sometimes it's by design. You might not have refrigeration available everywhere you're serving food, like summer feeding sites, or it could be in response to an emergency. but you may use time as your only criteria to keep your milk safe. And it's important to have that standard operating procedure on hand as well. That's what I picked for you guys as far as resources and support by ICN. If there's other things on your mind, we're going to be sticking around for questions and answers. I'm excited to have Judy Pullman join us as well, since she is currently a food service director in Wayne, Nebraska. So if you have questions, concerns, or conversation about what it's like to serve milk in the programs, that is a fantastic opportunity on top of the science and history and celebration of the last 100 years of safe milk. I invite everybody to come into the Q&A session with me. And Josh will be leading us through questions that have already come through. Thank you, Josh.
All right. Thanks so much, Sharon. Really appreciate that. All right. We can have all our panelists back on here. So again, welcoming back Dr. Van Kessel. Judy's on here. We have Kayla also to help with any food safety related questions, milk questions. We already got some in the Q&A session, so we'll go ahead and start with those. And if you come up with any as we're talking, please feel free to put them in there and we'll try to answer those as well. All right, so there's certainly some concern, obviously, and questions about avian influenza and its effects on the dairy world. Joanne, do you mind maybe talking a little bit about that, what you know on how we're keeping cows safe and the milk supply safe with the avian flu?
Sure. Well, virology is out of my realm of expertise, but I have been following this some, and so the avian influenza, for those of you who don't know, has been since March detected in some dairy cattle herds in the country, and most recently it's had a large impact on the herds in California. And so I think the question was on how it impacts the cows and the milk. And so the cows do exhibit, symptoms of GI type symptoms, and it does impact the milk production. The cows do get sick. They have a bit of fever. And what I want to tell you is that, when this first set out, everybody thought, well, it's a virus, pasteurization, that this is not going to be a risk to the consumer because of pasteurization, and that's been confirmed. FDA and ARS did, USDA and FDA did studies to just confirm that with this particular pathogen, that the current pasteurization methods are effective at killing this pathogen. So if it does get into the milk supply that's being processed, there is no risk to the human consumers.
Great, thank you. Good points. This next question, I'm gonna ask Sharon and Judy to chime in here. We have and it reads, we have a lot of lactose intolerant students, and I'm having trouble finding whole milk lactose free. Is this something that is available throughout areas, or is it normally skim 1% or 2%? Infants can only be given whole milk. So is there an alternative available?
It is location specific, because like Dr. Van Kessel just reaffirmed, milk is always a local product. So I cannot guarantee that every single area it's available to you, but our largest two distributors in the nation, both Cisco and US Foods, carry a lactose-free whole milk. You might have to ask your particular region to bring that product line in. And then the other thing is they won't be able to bring it in, logistically speaking, unless there's enough volume. I have looked at retailers across the nation, and stores like Kroger, Walmart, Publix, a line called Clover Value, which is represented in Dollar General, as well as Fairlife and Lactaid. They're all national. I don't know how often you go to retail stores to supply allergy solutions for your school meal programs, but I know that that does have to happen sometimes. I hope some of those solutions might help. Judy, anything to add?
No, other than if you go to your local grocery store, the family might be looking for it to buy at home. So sometimes that's work for us. Because the store brought it in for us and for them to buy.
Excellent point. The caregivers of the child with the allergy is always a good resource of information. Thank you so much.
All right, great points. Thank you, Sharon and Judy. So our next question here, talking about organic milk, which, you know, we get this question frequently just in the food safety realm. I'll let Dr. Van Kessel answer this one. Are there any big differences in organic milk for children? Is it better, about the same? You know, keeping within the realm of food safety, here's from Lauren Thomas. What could you say about that?
Yeah, so the processing aspect for process for organic milk is the same for conventionally produced milk, and so from a food safety perspective, I see no difference.
All right, and that is our general response as well to most products here. So thank you for that. All right, let's see what else we have here. So we had some questions about antibiotics. Now, Dr. Kelsey, you talked a lot about this in some of your research. I think you probably addressed this, but if you want to expand a little bit, there's a question from Kristen here about, are antibiotics passed into the milk that we drink? I think there was another question about antibiotics. That might be it. You want to just maybe expand a little bit about antibiotics in dairy production? Is there risk there transferring to milk, all of that?
So when a lactating cow is treated, when a cow that's giving milk is treated with antibiotics, it depends on the antibiotic used and the delivery. Like, was it treated with a shot in the rump, or was it treated for mastitis, which means it was then could have been treated directly into the mammary gland. So treated animals, yes, the milk can have antibiotics and antibiotic residues in them, but this is why there's strict regulations on how they're used in the dairy cow, and on the testing to ensure that those regulations are followed. So an animal that does have milk antibiotics in its milk, that milk is diverted from the retail milk supply. It never goes to processing. And the producers have they have tests that they can use themselves to ensure that they're not that they need to test a cow before they put her milk into the bulk tank. They can do that, but all the milk is being tested. Every single load of milk is tested for residues of many antibiotics. So I can't stress that enough to say, no, the milk that you're drinking from the retail market does not have antibiotics in it.
Thank you. No, I think it's important to keep stressing that, because obviously we hear a lot of information out there that's not totally accurate. So thank you for that. Here's a quick one, probably easy one for you, I think. What do systemic cell counts mean, and what levels are safe? And that's from Tamara.
So I think, Tamara, you might be referring to somatic cells. Not 100% sure, but so something I didn't say that I'd wished I'd intended to say in my presentation was that the milk, when it arrives at the processor, it's tested for various things that indicate hygiene levels, at the farm essentially, and some health indicators for the cattle. And somatic cell counts are and I'm going to get myself in trouble because I'm not a physiologist, but somatic cell counts are used as a general indication of the health of the udder of the cow. And so the level that is set in for what is acceptable or not is the U.S. has a set level. I think some processors set their own level below that. Each country has a different approach to this. So I'm a little hesitant to give you a number because I'm not exactly sure what the local numbers might be for an upper level of acceptable somatic cell counts.
Well, thank you. Among all of us, you would answer that much better than we would. Thank you, Dr. Kessel.
Okay.
All right. Let's see what else we have here. And again, feel free to continue putting in more questions as we talk through these. Let's see. Judy, I think it'd be interesting to hear your perspective here. There's just a comment from Linda just talking about supporting our farmers, so important with so many dairy farms decreasing. Just getting milk in the Southeast is increasing difficult. Have you experienced that in your area? You have any suggestions or tips about this?
Milk is, well, usually they consider milk local. A couple years ago, we had carton issues, so we took skim or whole or whatever you could get for the carton. I would say your major supplier that you get groceries from, I think Cisco and Cashway and US Foods all carry cartons of milk, if that helps you.
And Judy, what about consumption? Have you seen the interest in actually consuming milk drop at all with kids in your area?
No. I think sports and sports nutrition and the link between muscle mass and after you work out, milk as a rehydration drink has helped us. I think make sure, like, knowing your dairy farmer, if you have local dairies, invite them in to speak and let the kids know how milk gets from the dairy to the school. The farm to school month, the second grade learning activities in the classroom. And dairy is safe, and getting to know the milkman that delivers the milk to your building. And seeing his truck and that relationship. Because everybody is going to have a milk carton that leaks. That's just how it is. But if you have that relationship with your milkman, maybe he'll keep his truck a little cleaner, or there's a lot of foodborne illnesses. But in all my years, I don't ever remember a milk recall.
Thank you.
You're welcome.
Yeah, we really appreciate that perspective. Thank you, Judy. Looks like we have a question related to plant-based milk options. I'll pose this to you, Sharon. Why is and this is from Daphne, asking why is plant-based milk options not trending among school districts? What's your experience with that?
Sure. So when I was a child nutrition director, I also saw an increase in milk allergies. There actually has been about a 50% increase in 1997 to 2011, and another 50% increase from 2007 to 2021. So it is something that's on the rise. Number one, I don't have substantial research on whether or not we're just better at identifying that allergy or if there are, in fact, more people that are allergic. But in school nutrition, although the number is increasing, making sure that each and every student is receiving a nutrient-dense product is the most important part of our job. The chef part of my heart says, number one, it has to taste good. The food safety part of my heart says, number one, it has to be safe. But at the bottom line of everything we're doing in feeding children is making sure they're receiving the nutrients they need to grow and to learn. What we find with most dairy replacements is it doesn't come to the table with the same package of nutrient dense and essential nutrients. I said nutrients way too many times, forgive me. But it's hard to find a replacement that has the same lineup. The other thing that happens in school nutrition programs is you need to consider the other allergies. So some of the plant-based products come from soy or nuts. Those are also part of the top 9 allergens. So by replacing it with another allergen that could be dangerous for other students, or that same student is a dairy almond, so there's no way to present them with those items. Some schools are in fact nut free, and then that would eliminate all of the nut options right there. Judy, how about you? How are you dealing with increase of milk allergies? And do you see a spike in the Midwest on interest in accessibility for plant-based milk?
Sometimes I get requests for plant-based, but it has to meet the Department of Ed criteria. So I would say check with your Department of Ed, and they will give you a list of plant-based milks that usually that you can find in your area.
Yeah, for me, soy milk was the easiest to locate if you truly needed a plant-based option. And then also look, if it's just a lactose intolerant, working with a lactose-free cow's milk might satisfy the medical need for some of your students.
Fantastic. Thank you, Sharon and Judy. So here's a question to the panel. Actually, I'll ask Michaela if you want to weigh in first. So we do a lot of food safety education, of course, and there was a question from Katie about how do we collectively work together to educate consumers about the importance of pasteurization? Do you have any, from your time as an inspector, any insights there? And we can open it up to the panel as well.
Yeah, no, great question. And thanks for that, Josh. I think in general, just when we're discussing food safety, whether it's, pasteurization, just safety in general, it has to be a collaborative effort. So I always just make the important note, and I think Judy actually mentioned this as well, getting to know who your suppliers are, knowing who your regulators are, really building those relationships, I really feel like helps kind of get the message around that food safety is important, and that's in all aspects, whether we're speaking of pasteurization, time and temperature control, date marking, all avenues. So it's a collaborative effort.
Anyone else have any thoughts to add on the education component? Well, I'll just say, this is what we're doing right now, right? We're sharing our information to all of you. Of course, we're trying to educate on pasteurization to provide you as school nutrition professionals that knowledge. So when you do get questions from parents, consumers, or anyone you're interacting with, you have that knowledge. So, we want to implore you, continue to come to our resources, ICN's resources, share those with the people you interact with, especially the parents and the children that you serve. That's how we're going to continue educating. So great question on that. All right. I think, we've really kind of hit on a lot of topics here. I don't see too many questions coming in, or really doesn't look like we've have any more. I'll keep it open for another minute or two. Judy, I was going to ask you just, all of your years of experience, dealing with not only living in it from growing up on a dairy, any other words of wisdom or tips and tricks related to dairy you'd like to share?
I think we're spoiled. We're so used to going into the local grocery store and grabbing a carton of milk, a gallon of milk, and knowing that it's good, that we take for granted the pasteurization and the homogenization. And it's just whether you get the pink, blue, or green lid. And we're really fortunate that the laws that are in place were in place and that we do this. Because I know the dairy industry has worked hard to have a quality product on the shelf.
Absolutely, they have. I agree.
Yeah, one of the things that I would love to challenge our audience to do is work with the team in your school that coordinates field trips. It is a fantastic opportunity to visit a dairy farm. I've been to one many times, and even to learn about the diet that the cows are on. I used to feel so bad for the Nebraska cows when I lived out there, like, oh my gosh, they must be cold. And you would read articles before I worked with milk and with child nutrition. It's like, oh, they're not treated well. You go out to a farm, and let me tell you, as a previous lactating woman, if you're not treated well, the milk doesn't flow as well. So they are kept warm. They are on proper diets. They're receiving massages. It's just amazing to bring kids to a farm and interact with the cows. And they'll normally let you do a photo op with some of the babies that are just old enough to sit by your side and be cute as can be. So help create that connection to where food comes from, and plan a field trip at a dairy farm. Another opportunity would be you can adopt a cow. I don't know how many school programs are out there, but there are chances for you to adopt a cow. And they send you pictures of the dairy cow. They send you the name. They tell you how the cow is being raised, what it's eating. And all of this could be displayed in the cafeteria to help create that connection with your students, your staff, and yourself. So just a few fun ideas that you might want to look into.
Your local state and dairy associations are great resources for finding out farms that you can go visit, or virtual visits, field trips. So don't be afraid to reach out to them.
I agree. And also having folks, from the farms or from the extension agencies, or if you're near an ARS research site, we like to go into the schools too and, interact with them. And sometimes, I've brought in like 10 empty gallons of milk and just, try, and talk to them about what cows eat and bring in examples of that. And I think it really helps to connect the children to their food. And if you can't make the farm visit work, because that would be ideal, but if you can't make that work, I try to get folks to come in and talk with the students, and I think that's helpful too.
Well, those are some great thoughts, I think, to leave on here. Thank you so much for getting some great feedback. Thank you to all the participants today. Let's hope for another 100 years of milk safety to the next 100 years of the PMO. Thank you again. This will conclude our session today. And just be on the lookout for additional FNS Food Safety Continuing Education webinars. We do hope to have more in the future and continue these through the year. So look for announcements on those. and we really appreciate your participation. Thanks again, and have a great day.